Okay, so next on the list we have elastomeric impression materials. So these materials, they differ from our hydrocolloids in that they are not affected by atmospheric conditions. Remember, with the hydrocolloids, especially alternate, is water, heat, dryness could all cause the material to act in adverse ways. So this one is very rubber-like and very elastic, especially after, like, once the material is set, which is great because it is required, or it is used in areas where we require precise adaptation, such as when we're taking impressions for crowns as well as bridges. So the biggest advantage of these materials would be that they do not distort and they do not tear, essentially. So distortion, ladies and gentlemen, is basically defined as the lack of a change in dimension. So basically, when you take out the tray from the patient's mouth, the impression of what you took will not be affected. Does that make sense? Okay. And then from there, elastomeric materials have three subdivisions. There's your polysulfides, your polyethers, as well as your silicones. So all of these names you need to know, as well as the individual properties, like I'm covering right now. And then a catalyst is used. So with your elastomeric materials, we're still going to have an extruder gun. So the extruder gun will have like your two chambers or your cylinders. The one has a catalyst and the other has a base. So because you'll be using an extruder gun with a fine tip at the end, the extruder gun allows for an equal mix of the catalyst and the paste. So in that way, there will not be cross-contamination. You will be getting an equal volume of both the catalyst as well as the paste, and then it will also minimize like wastage, as well as like spoil or the material changing, because it's not used in the correct ratios. So now basically with the catalyst and the base, you're going to find there's a lot of products, especially with the materials we're talking about today, that have a catalyst and a base. So basically the catalyst is a material that accelerates or begins the process of self-curing. So once the catalyst and the base basically combine, it is the catalyst that then begins the chemical reaction that brings about our material setting eventually. And then from there, basically the process of our material setting is basically called polymerization. So the catalyst and the base undergo a chemical self-cure. So basically they react by themselves to bring about polymerization, which brings about the impression that you will eventually find in the patient's mouth. And then you can also even use elastomeric materials, like the one I just described as like a heavy body. So that would be like the one that you find within the tray, and then you're going to still then use a light body material that you as the assistant are going to like either mix or use the extruder gun that you're going to place on the tooth itself, and then put the elastomeric material, and then that's how basically you get your impression. Okay, like I said, it's very complicated without the things actually in front of you, but you will be going to the lab for your practicals, so they will make much more sense. So it's the extruder gun, and then the extruder gun basically uses the fine tip to get the material into the patient's mouth. This fine tip, ladies and gentlemen, cannot be disinfected, cannot be sterilized. It's a single-use tip, and even the extruder gun itself, please always make sure that you disinfect it after every use, so that you do not cross-contaminate between surfaces and between patients, as well as yourself as an assistant, as well as for me as a dentist. So like I said, elastomeric materials have three subdivisions: your polysulfides, your polyethers, as well as your silicones. So we're going to start first off with our polysulfides. So our polysulfides will still maintain the main characteristics of the umbrella term being elastomerics. Okay, so polysulfides normally come in two tubes, which is the base as well as the catalyst. So with polysulfides, you'll see that the base is normally the larger tube, while the catalyst is the smaller of the two, and the base tube is normally white in appearance. So it's the larger white tube, whereas the catalyst is the smaller reddish tube. So The catalyst still works as the accelerator, just as we had mentioned earlier before. So polysulfides have advantages and disadvantages. Yes, we expect you to know them. Ne? So the advantages would be like it is stable after it sets, like we talked about distortion and tearing earlier on. It is very accurate, hence we use it with crown and bridge patients where you require precision and accuracy. It is very detailed, and it has a long shelf life, like it can last for years and years on the shelf. Okay, then the disadvantage with it is that it is prone to staining because of the redness of the catalyst. And then from there, it has a very bad taste and odor. The smell is basically because of the sulfur in the polysulfide, which is the sulfur in the base. That's normally the smell. And then it has a long set time. So between mixing everything will take about 4 minutes, and for it to actually set in the patient's mouth could take about 6 minutes. So that is quite time consuming when you compare it with your alginates that could set in between 1 to 4 minutes. Né? So it's actually quite long, but it's very accurate at the same time. And because of like it's staining and getting everywhere, like I know when we were in varsity, they'd recommend that we actually place Vaseline all around the patient's mouth and oral cavity before we actually take an impression with polysulfide. So basically polysulfide, I think they're going to teach you how to actually mix polysulfide in the lab, so I don't want to go into detail, but basically you put on a paper pad 2 strips of your catalyst, 2 strips of your base. Ne? So there'll be 2 people mixing. The one mixes for our impression tray, and then the other one mixes for our syringe. So the one obviously who mixes for the syringe will obviously mix first. You mix the catalyst into the base. That is very important. Ne? Mix the catalyst into the base. So you mix until it's an even color. You're going to see that the white and the reddish maroon of the catalyst are going to make like one even homogeneous color. So once that is done, once you're close to finishing mixing that, then the person who's mixing for the impression tray can then start mixing. Then obviously you're going to backload to your syringe, and then they're going to backload onto their tray. And then you're going to give it to the dentist, who then takes their impression, waits 6 minutes, and then takes it out of the patient's mouth. So that's that with polysulfides. Next on the list, we have our silicones. Ne? Our silicones, just like the other elastomeric materials, come in tubes of a base as well as a catalyst. The silicones, however, have a lot of different forms, the main one being your putties. Ne? So your putty will have 1 tab of catalyst, 1 tab of base. Ne? And then the nice thing about silicones is that they act just like your polysulfides, but without all the disadvantages. You remember we talked about the taste, the bad odor, the staining on the patient's clothing and stuff. That does not happen with silicones. However, they are more expensive than your polysulfides, so that would be the main disadvantage. But normally we use them to take impressions, especially in private practice for things such as scalds. We use silicones then to take impressions for such type of aesthetic work. So then silicones are also used for your heavy type of impressions, and they have a lot of advantages, such as being very accurate, they're very dimensionally stable, and they also do not distort. They do not have a taste and an odor, just like the polysulfides. And then from there, they also have cartridges that you can also use in an extruder type of gun. And then guys, since I was talking about the putty form now, I need to remind you guys as dental assistants, this is very important. When you're mixing the base and the catalyst of silicones, you're going to take, let's say, 1 scoop of the base, 1 scoop of the catalyst. When you mix them together, please mix them without the gloves. Do not put gloves on, otherwise you're going to affect the setting as well as the reaction of the material. Then silicones normally come with their own little scoops, like teaspoons, for you to take 1 scoop of the base, 1 scoop of the catalyst. Please also do not mix the scoops, because then it will also cause a reaction. So you're going to find if you use the same spoon to pick up both the base and the catalyst, you're going to cause a cross-contamination, which is going to cause the material to be hard and useless. So basically it's a waste of money. So please do not do that. Ne? So even in as much as you use it for your heavy type of impressions, even light cured materials are also available in the form of silicones. So yeah, I think that's that. And then we will be off to our polyethers. So our polyethers, basically they have tubes as pastes, also base and a catalyst, but they themselves are stiffer than most materials. So I think that would be like the greatest disadvantage when it comes to polyether material. Next, ladies and gentlemen, we have gypsum materials. So gypsum materials are basically the materials that we use to make casts and models with in the lab. Ne? So there's 5 types of gypsum materials. Please know all of them. Ne? Know all of them, the 5 types, know their water to powder ratios. The table is on eTuto along with these 2 presentations, okay? So please study that table and know it very well, because between the 5 types of materials, they differ with a lot of things, be it the water to powder ratio, the dimensional stability, the strength, the resistance, the accuracy of detail, etc., etc. So please just know all of that. And then from there, we have plaster being a type 1 gypsum material. This one is normally the cheapest and the least expensive to use, and normally it's the one that we then use to fabricate our models, especially for prosthetics, dentures in particular, okay? And then, like I mentioned before, the 5 types which vary in strength and detail. So basically gypsum comes from a rock, ladies and gentlemen. So then this rock gets mined, and it comes out obviously as a rock, and then it is ground down into a fine powder, né? So then this powder that comes from the rock is then put into large cylinders, and then different heat temperatures are placed onto this fine powder that we have. So depending on how much water it loses, it will depend, it will cause one of the 5 types of gypsum, né? So this process is basically called calcination. So how much heat is placed between one of the 5 types will not be the same. So the amount of heat placed for gypsum to become plaster, for example, will not be the same as the amount of heat that is placed and how much water leaves when heat is placed on, for example, gypsum to make orthodontic models and stuff. So the calcination process, just know that term for me, okay? And then yes, okay, we're almost at the end, okay? Then we have trimming and finishing of diagnostic casts. So this would be your models for orthodontic cases. So this will establish an occlusal relationship between the mandibular as well as maxillary arches of the patient, and yes, they form basically part of the permanent record of the patient. So it is very important that they look presentable, because it is a reflection not only on you but the practice as a whole, in how you conduct yourself and you present your work to the patient, and how you present your records and you keep your records. So basically they have a standard appearance, and they're normally made out of white cast. I think it's type 3, so the lab gypsum, so one of the 5 types that we just discussed about 2 seconds ago, né? So they have a standard appearance, and basically we normally put them into occlusion using that wax bite as well, the wax bite registration that we took earlier on in our lecture. And then from there, they have also standard guidelines on how you actually trim orthodontic models. So I'm not going to go into that because it's actually quite a long process, but I think you guys will actually do it practically if you haven't done so before. So whatever you're taught, please take it seriously, and that's basically how you trim your models. It'll probably be asked for in your practicals.